Start.
Well, a very good morning, ladies and gentlemen, and I welcome you to our live session on hair wellness. I'm Deepti Diwan, your host for today, and we shall be talking about hair care in winter. Our hair is our crowning glory. It symbolizes our personality and tells people a lot about us. Having strong and healthy hair can indeed boost our confidence. So it's very important that we protect our hair and keep it looking gorgeous every single day and in all seasons. This winter, ladies and gentlemen, let's care about our hair from the roots to the ends. And now it's time to meet our hair expert, Dr. Amrita Srivastava. Dr. Amrita has received the Young Dermatologist Award in award paper presentation session of Cuticon UP UK 2014 for cutaneous manifestations in internal malignancy. She has also received the Best Poster Award in Cuticon UP UK 2014 Zoster cutaneous metastasis, and she has received the second prize in IADVL GSK National Quiz Program for Postgraduates 2014 and the second prize in IADVL Cuticon UP UK 2013 award paper session. Dr. Amrita Srivastava has presented poster on generalized hyperpigmentation in systemic diseases at IADVL Cuticon UP UK 2013 and presented a paper and poster in International Dermatopathology Conference Jaipur 2013. She is also a certificate of course in International Congress of Dermatology in Dermatopathology. So welcome, Dr. Srivastava.
Good morning.
Good morning, doctor. Thank you so much for joining us. Doctor, our viewers are looking forward to this session and आज हम बात करेंगे हेयर केयर के बारे में. तो सबसे ज़्यादा कॉमन जो हम देखते हैं विंटर सीजन में वो है डैंड्रफ की कंडीशन. तो डॉक्टर सबसे पहले हमें ये बताएंगे प्लीज कि डैंड्रफ एग्जैक्टली होता क्या है.
Dandruff is basically, if we talk in the term of layman or normal individuals or our patients, it is only a visible flaking from the scalp. It can be seen like white scales coming out from the scalp or visible on your hair. And scientifically, dandruff is shedding of the upper layer, keratinized layer of a scalp from the scalp gradually or in more intensity associated with itching or inflammation or sometimes pain. So basically, dandruff is a type of seborrheic dermatitis, an inflammatory condition of the scalp.
Okay. Thank you, doctor. Doctor, people who suffer from dandruff, they generally are scared of the winter season. So is there a link between dandruff and winter season?
Yeah, in winters, there is overall dryness over the scalp, over the skin areas, because there is more transepidermal water loss in winters because the external environment is very dry and rough. So our body compensates with increase in the transepidermal water loss. That's why scalp is also became dry. And to compensate dryness, there is increased shedding from the keratinized layer of the scalp. So dandruff generally in more prominent in the winter season in normal population, except from few conditions where the dandruff persists throughout the year in all seasons.
Okay. Doctor, what is the difference between dandruff and seborrheic dermatitis?
Yeah. Nowadays, people are aware of seborrheic dermatitis. Sebum means the oil from the sebaceous glands or oil secreting gland. So any inflammation in the sebaceous glands is known as seborrheic dermatitis. The sebum secreting gland are predominant over our scalp area, over the face, over axilla, means the armpits and the groin. So the any inflammatory diseases in this area is known as seborrheic dermatitis. But there is a slight link between dandruff and seborrheic dermatitis, and you can say it is the mildest form of the seborrheic dermatitis. And it only restricted to the scalp only. So where there is slight or no inflammation, means there is no symptoms, no itching, only flaking from the scalp is known as dandruff, or it is scientifically known as pityriasis sicca. It is the mildest form of seborrheic dermatitis. So here is only a cosmetic concern, no any medical treatment required.
Okay. So, dandruff, you said, is the mildest form of seborrheic dermatitis.
Yes, yes.
Okay. Thank you, doctor. And doctor, what are the external factors associated in causing dandruff?
Dandruff basically, as I already said, it is very commonly related with the dryness. So any condition which increases the dryness, like sun exposure, excessive sun exposure, any cosmetics which causes dryness, like very boys and girls are very fond of various jelly and cosmetics application over the hair and the scalp. Emotional stress can also causes a few hormonal disturbance which causes dryness of the scalp. But basically, dirt, sun exposure, various cosmetic uses, mental and emotional stress causes, and winters, uh, and people working in the areas where there is very much heat. So in that cases, there is a increase in the dryness over the scalp, which causes more flaking from their scalp or dandruff.
Okay. And doctor, some people also feel that if they shampoo their hair too much, then they tend to get dandruff, or
Yeah, yeah,
too
yeah,
much
yeah,
combing. So that also makes a difference.
yeah, yeah. Actually, in shampoo, in most of the shampoo in the market, there is a sulfates which causes dryness of the scalp. So anything, any cosmetics, included shampoo or various grooming products which causes dryness, it increases the chances of dandruff.
Okay. Thank you, doctor. Doctor, could you please tell us a little bit about the etiology of dandruff? Which are the microorganisms that cause this?
Yeah, basically, there is a disequilibrium which causes increased flaking in the scalp. The few things are first of the microorganisms which can causes a role in causing dandruff or seborrheic dermatitis. There is a very common fungus, Propionibacterium Malassezia furfur, and bacteria like Propionibacterium acne and Staph aureus and Staphylococcus epidermidis. There is in all individuals, in all of us, there is an equilibrium between these bacteria and Malassezia, a most common fungus. These bacteria and fungus normally present in all individuals, like 100 to 150 microorganisms per millimeter square. They normally present in all. But in certain conditions, there is a disequilibrium. Like if patient taking treatment for acne and various other diseases, we can give them antibacterial. So in that cases, Malassezia overgrowth over the normal these bacteria. So, in various conditions, other conditions like application of various antifungal lotions or antifungal shampoos, there is a decrease in fungus and increase in bacteria. So, in that cases, there is a disequilibrium between the organisms. Normally, Propionibacterium acne and Staph epidermidis secrete certain chemicals which restrict the growth of Malassezia, and similarly, Malassezia secrete some bactericidins which restrict the growth of bacteria. So there is equilibrium, but in various circumstances I described earlier, this equilibrium disrupts, and there is increased growth of Malassezia normally. In that cases, increased dandruff, and if increase in the number of bacteria, there is various type of folliculitis or hair follicle infection and inflammation. So first of this disequilibrium causes increased cases of dandruff. Second thing, these fungus also secrete various enzymes, including lipases, which disrupts our sebaceous sebum secrete from the sebaceous gland, and which increases the concentration of various fatty acids like oleic and arachidonic acid. These acids increase inflammation over the scalp, which symptomatically causes itching, pain, sometimes plague, sometimes crusting, sometimes bleeding from the scalp. So these are the two main pillars or main cornerstone behind the etiology of the dandruff and seborrheic dermatitis.
Okay. So you're saying that the microorganisms are present on a normal healthy scalp.
Yeah, normal
So
healthy
if
scalp, but
any equilibrium is lost, then they act
the
upon it.
number of these organisms then increase 2 to 3 times in diseased individuals.
Well, thank you so much, doctor. And doctor, a lot of people who have dandruff, they complain about hair loss. So is there a connection between dandruff and hair loss?
Yeah, basically patients who are more symptomatic and connected with various internal problems, various nutritional deficiency and diseases also disrupt the equilibrium. In that cases where there is some internal complications also, there is a sudden shedding of the hair, large amount of hair. Like if there is a normal shedding of hair is 50, vary from 50 to 100 in normal individuals, it increases to 100 to 200 hairs. The condition is known as telogen effluvium, where the old hair or resting hair fall from the scalp uh, in a very short duration of time. So patient worry from in that situation, and it also increases the androgenetic alopecia pattern. Also, the hormone-related hair loss they also increases. And third, because of the symptoms, there is a repetitive itching. So scratching of his scalp also causes frictional loss of hair. So in severe type of dandruff, not in the mild cases, severe dandruff more associated with inflammation causes hair loss.
Okay. Thank you, doctor. And doctor, finally, now let us discuss the solution, the treatment options for dandruff that are available today.
Yeah. In the treatment, we generally treat the patient in toto. Means first there is a symptomatic improvement in the patient, because dandruff mild to moderate cases is only a cosmetic concern. Patient feel bad or patient do not like the white flakes over the hairs. So in mild cases only a cosmetic concern, but in severe form there is more of symptoms, hair loss. So first of all symptomatic treatment and then treatment of the cause. What is the cause behind this condition in particular individual? The cause in all individuals generally differ. So in symptomatic treatment, we have first, if there is inflammation, redness over the scalp, there is a certain degree of swelling, then we use topical steroids, topical calcineurin inhibitors in that cases. If there is flaking and crusting, then we use keratolytics, salicylic acid based shampoos and lotions. If if we found there is patchy involvement which denotes there is increased number of fungus, then antifungal lotions and shampoos which usually prescribe. And if there is more of follicle involvement in case of scalp, there is a basically not diffuse involvement, only follicles are inflamed, then there is more chances of an pus formation. Then more there is pityriasis folliculitis, then antibacterial treatment is given to the patient. So this is the symptomatic or patient which complains of various symptoms, then the management is accordingly. Then what is the cause behind them? Like Melisselzia growth increase in hospital admissions when patients are admitted for various conditions or disturbed emotionally or mentally. In that cases, Melisselzia growth is very much increased. So in that situation, we support the patients in that way also nutritionally, and we counsel patient that when their antibacterial and other treatments will stop, they resume the overall equilibrium gradually, and with we support very we give them supportive management accordingly. And if there is other conditions like sometimes psoriasis or sebopsoriasis, basically sebopsoriasis in them. So if keratinization is disturbed, then we manage with various oral agents accordingly to establish the basic keratinization pattern. So in sometimes there is immunocompromised patient like diabetics, HIV individuals. There is increased sebum production and increased growth of Melisselzia. So we sometimes, if patient is very resistant and recurrence of this condition very frequently, then we identify the various immunocompromised status in them, like thyroid and diabetes and other various cancers. So we identify the problem and then we treat accordingly. A very common condition like vitamin B deficiency, it increases sebum production. So in many vegetarians, we correct their nutritional level according to their vitamin B, ferritin, and vitamin D level. So in that way, the treatment of cause and treatment of symptoms, we manage our patients.
Okay. So for symptoms, then you have the anti-dandruff shampoos, the lotions,
Yeah.
and do you also prescribe any oral pills, like any medicines?
Yes, oral pills, depending on the cause which I described. If there is only nutritional factors, then nutritional anti-inflammatory. If inflammation like psoriasis like condition, then oral inflammatory and anti-proliferative drugs like retinoids, like methotrexate, like various other agents, cyclosporin, etc. And sometimes oral steroids also. And if associated with various internal problems like mental diseases, neuropsychiatric problems, cancers, diabetes, thyroid, then treat the internal causes accordingly.
Okay. Thank you so much, doctor. That was very informative. With that, we come to the end of the questions. Now, we shall be taking questions from the audience. So, one of our viewers would like to know, can I cure my dandruff with anti-dandruff shampoos?
If there is only mild increase of flaking, or this is only a mild where there is a only flaking from the scalp, you can treat with anti-dandruff shampoo only. If there is crusting and symptoms are inflammation over the scalp and the condition is resistant, then only shampoo is not adequate.
Okay. Thank you, doctor. And our next viewer would like to know, can dandruff spread among family members?
No, no, no. It is not contagious. So it cannot spread from direct contact or in family members or friends.
Okay. Can babies get dandruff?
Yeah, yeah. Seborrheic dermatitis is predominant in three age groups. In first 3 months, it is very more, uh, I think,
Prevalent.
yeah, prevalent and persistent also because of the mother's hormones, estrogen. Because of the estrogen, they have cradle cap or crusting over the scalp. So in first 3 months, then during the puberty, when there is a pubertal growth, 9 to 11 in females and 11 to 13 in males generally. And then after the age of 40 to 60 years, means our elderly individuals, they have compensatory more secretion of sebum. So three age groups are more commonly involved with the seborrheic dermatitis and dandruff.
Okay. Thank you, doctor. Should we wash our hair every day if we have dandruff?
No, not required. As already I told, if there is increased dryness, there is more chances of dandruff. So if you have a lifestyle where you have to go in more hot and humid weather or humid conditions, or environment is very hot and humid and you sweat profusely, then you wash your scalp daily, but with mildest shampoo, not with very harsh or sulfate rich shampoo. Then you talk to your dermatologist, they will prescribe you a very mild shampoo. Otherwise, if the work style is not that where there is sweating and hot weather involvement, then twice per week the shampoo is adequate.
Okay. Thank you, doctor. Doctor, does diet play any role during dandruff?
Yeah, diet is very important.
Okay.
Diet is very important. If there is deficiency of essential fatty acids in diet, and there is a chronic deficiency of vitamin B group of vitamins, basically vitamin B2 and B12, and deficiency of vitamin D, then increased chances of dandruff. So dandruff generally we see more common in vegetarians, strict vegetarians people. So there is a there is more deficiency of vitamin B and vitamin D in them. So diet is very important. So take balanced diet, adequate water, and also 30 to 40 minutes regular exercise for adequate blood flow.
And no stress.
Yeah, obviously.
Yes. Yes. Thank you, doctor. And doctor, does exercise play a major role in dandruff? You just
If
mentioned 30 to 40 minutes.
yeah, because if we follow sedentary life, uh, if we do regular exercises for minimum of 20 to 30 minutes, our whole system work very smoothly. Like our hormones are balanced, like insulin and thyroid, and various good agents formed in our body, which are known as endorphin, enkephalins, which are anti-inflammatory. So various stress are burnt out with the exercise. Our mood is enhanced. Our hormones work properly. Our metabolism work properly. In that cases, the absorption of various nutrients from the body. So overall, everything is balanced. So if we follow sedentary lifestyle, everything are stopped, and there is a hormonal disbalance, and there is more weight gain. So dandruff also common in more healthy obese individuals. So daily exercise is very important in case of any inflammatory disorders, including seborrheic dermatitis and dandruff.
Okay. Well, that was some new information we learned today, doctor. Thank you so much for that. And doctor, our next viewer would like to know, can hair dyeing lead to dandruff?
Not generally. If there is allergic reaction secondary to any hair dye or hair cosmetic, then it increases the flakiness from the scalp. So, if the agent causes you dryness, then use the conditioner and use oiling after the application of dye. It is more than sufficient to decrease your flakiness.
Okay. Thank you, doctor. Doctor, our viewer would like to know, can home remedies such as curd on the scalp treat dandruff?
Sorry. Basically, there is lactic acid in curd, so it decreases. Lactic acid is very good hygroscopic agent. So in that way, it smoothens the scalp or the skin. But in allergic individuals or with sensitive skin, we generally not prescribe these home remedies. But if you do not have any allergy, you can use curd. It decreases, obviously decreases your flakiness and smoothens the scalp because of the lactic acid. But if you are allergic to any agents like lemon, curd, then talk to your dermatologist, because in some individuals there is some sensitivity to unbuffered, because these are unbuffered agents. So uh, in sensitive individuals, not advised.
Okay. Thank you, doctor. And doctor, our next question is, how can I prevent dandruff naturally without the use of any shampoo?
Naturally, as I already told you, do not dry your scalp first of all. So use your hair agents, your shampoo, conditioners, oils, serums accordingly. If you have any issues, talk to your dermatologist. Follow a healthy lifestyle with a balanced diet, regular exercise, regular sleep, and if you have any internal problems like diabetes, thyroid, and other issues, then go to your physicians accordingly. So, in that way, if you have balanced everything, then obviously there is no disease, including any inflammation. And in winters, you have to more care. Um, then you can, if there is dryness or you have dry hair, then oiling as per advised, and use the shampoos and conditioner accordingly, then you have no issues at all.
Okay. Well, thank you so much, doctor. With that, we come to the end of all the questions, and I'm sure that our viewers have found this session very, very insightful and very informative. Once again, we thank you for answering all the questions of our viewers and for taking your valuable time out. Thank you so much.
Okay, oh, thank you.
Thank you, doctor. All right, ladies and gentlemen, with that, we come to the end of another session on hair care. This winter, we shall be coming up with many more such sessions. So keep watching out this space. We'll be back soon. Until then, you take care.